Millions of Americans suffer from debilitating pain related to diet, behavior, and trauma. Now, traditional medicine often treats these people as the victims of their illness or their condition. But the medical facility we're visiting today is all about wellness and helping you achieve it. Hi, I'm Janice Marie, and we're here today in Staten Island visiting Real Medicine for Real People, specializing in physical medicine and rehabilitation. They've combined physical therapy, occupational therapy, massage, and acupuncture to help alleviate pain, get you well, and lead a healthy life. And many of their patients say the results are nothing short of miraculous. Let's take a look.
Physiatry is that field of traditional medicine that focuses on function. So our job is to take a patient after they've been through the system for whatever reason, whether it's a post-surgical patient, whether it's a patient who's had significant trauma, whether it's a patient who's had chronic repetitive injuries, and really focus on getting them to do the things that they want to do. And so that entails a lot of different tools. We use exercise, nutrition, medications, and all the usual armory of tools that a physician may have to get a patient there, but our focus is always on getting patients able to do.
Are you a primary care physician, or are you generally referred by a primary care physician, or do people just come in on their own?
Most of the patients are sent to me from their primary care doctors after a problem has been identified that they believe they need additional evaluation for. Many of my patients certainly are coming to me from other patients. And lastly, you asked an interesting question about being their primary care doctor. Physiatry is kind of a specialty in evolution also. And I anticipate that as medicine continues to go through its changes, that we will emerge as the primary care doctors for people with chronic issues and chronic disabilities. Because our focus, again, is always on seeing the whole functional patient and not just on an illness or a part. You know, to take care of a patient, you have to know everything about the patient. All right? And that's really just the way it works. When we in medicine have broken down patients into disease processes, we're losing something about the patient. And so somebody's got to put it all together. And that's really what we end up doing, is we put it all together so that we're making the right decision for this patient and not because of a diagnosis code or a disease code.
Back in February, I hurt my knee at work, which required surgery, and I needed a place to do physical therapy. I know Dr. DiSalvo for about 10 years now, because back when my daughter was born, she was born with cerebral palsy, and he was the physiatrist that treated my daughter. So when he opened up the new office over here, I said, you know, this would be a great place for me to come and do my rehab. Since I've been here, it's been nothing but a great experience. The physical therapists are very talented. I feel much better since I've been coming here. The staff is excellent every day on a daily basis. Even the secretaries ask me how I'm doing, how I'm feeling, if I'm getting any better. It's just like a warm, friendly environment here, family environment. Everybody knows each other on a first-name basis, and it's just been a great experience for me.
When you ask someone to make some significant lifestyle changes, I'm sure you encounter a lot of resistance to that. How do you help people overcome that?
Well, that's my greatest challenge all the time, right, is to make the patient a partner in their well-being. One of the most interesting things about the evolution of healthcare, I think, is the passiveness with which patients approach it. They come in, they expect someone to fix them. They don't see that they have to play a real strong role in getting themselves better. So I often describe that to patients that this is a partnership. I'm your coach, but this is a partnership. We've got to find what works for you, not just what works for me by the book. So we've got to explore this together and letting people know they can do it. And they can do it. It's just that you have to start small. And that's where you've got to take it. You take it in small steps. So if it hurts to walk a block, our goal is going to be to walk a quarter block. And once you start to walk a quarter block, gradually start to extend it. But you'd be amazed at how much support and guidance people need to do that, because if it's not something you've experienced, it's not something you can relate to. But once you go through it, it really is a training process to get people back to where they need to be. I think the biggest challenge when people make life changes is changing their language. They're very big on saying, I can't do this. So it's very routine for me to see a patient who come in and say, doctor, I can't walk. And I'll say, but you walked in. And teaching people the relative use of terms so that people are communicating better. Because can't becomes a very powerful word. You start to limit yourself when you say, I can't do it.
I had an injury to my arm, and I was referred to Dr. DiSalvo, and I started seeing him here at Real Medicine for Real People. And yes, I would recommend him to anyone that I see that's suffering with any type of condition as far as, you know, the arm or the legs. You know, he's a great doctor in the facility, and the workers here are excellent. Excellent. I feel welcome, and I feel like I'm getting somewhere finally, you know, through his treatment.
We help to establish a human connection, and that is healing. It's healing to be touched. It's healing to be cared for. It's healing to know that someone is on your team. And so many times that's the bulk of what you do for somebody. Because maybe the fix, and I always tell this to patients, the fix isn't in a bottle. That's not where it comes. It's going to come from a lot of different sources, and we've just got to sort through that and find the sources that we've got to get you to pull from to get better. I can deal with patients all day long. I get to educate a little bit. I get to guide a little bit. I get to help people see their lives in a different way.
Real medicine for real people, an individualized approach to health and healing that really can change your life. Reporting from Staten Island, I'm Janice Marie.